Hi, Phil Borders, Psychiatrist, Hendricks Therapy. We are located in Danville and Plainfield. And today we're going to talk about treatment for ADHD. You can do a few things for ADHD. One, you can encourage the people to exercise. That helps ADHD. Good nutrition, also beneficial. Not playing too many video games has been found to be beneficial for ADHD. But if you look at those three things, they're pretty much beneficial for everything. But can't hurt. Omega-3 fatty acids have been shown to be a little bit beneficial for ADHD. Avoiding food dyes can also be a little bit beneficial for ADHD. Not tons, but some. Certain types of cognitive behavioral therapy have shown to be beneficial. And of course, medications. Now, medications are basically two types. There's stimulants and non-stimulants. The stimulants, they tend to work better. The non-stimulants, they do have their place. I still use them. They tend to not work as well as the stimulants. So, that being said, what do I do when I give somebody a stimulant? First, you ask them, is there a family member, because we know it's very genetic, who's on a stimulant, and is it working for them? Or have they taken one that hasn't worked very well for them? And so you try to match stimulants up with family member stimulants because, again, it's genetic and they share, obviously, a lot of genes. If your mother is on Vyvanse and doing quite well, odds are the kid's going to be able to do quite well on Vyvanse. So you try to find out which might be the best fit. You also got to look at, what's affordable, what their insurance company will actually pay for. That's actually a big factor. And what I do is I just start with fairly low doses and then I gradually work my way up until the point where it's like, I'm functioning really well at school, I'm functioning really well at work, or, I'm having some side effects, I think we need to back off. So you kind of work it that way. Now, common side effects are decreased appetite. That's a big one, which maybe not so bad for a middle-aged dude, maybe not so great for a little skinny kid. So that's a side effect you have to be careful of, especially in young kids. There used to be a lot of thought that it decreased height. And the more I've read about it, the more they're thinking, maybe not so much. That decreasing in height for kids probably doesn't happen that much. If it does, maybe a centimeter. So that's something I tend not to worry about as much as I did, say, 25 years ago. For the stimulants, you have to watch out for the people's heart rate and blood pressure can elevate. Either those, stomach upset, once in a while. These tend to be morning medications or early afternoon medications, or maybe right after school medications, because you want them out of the system before the next, before they go to bed, because it can cause some insomnia. Now, one cool thing about stimulants is they're incredibly easy to stop because every day is a new day. It's not like an antidepressant where you have to take it for, a few weeks before it really starts working effectively. These suckers, they work tomorrow. And again, if it's a Saturday and you're hanging out by the pool and you don't need to think, you don't need to take your Adderall, you don't need to take your Concerta or your Vyvanse because you don't need to focus that day. Now, those days can be few and far between, but it shows you that, it's a medication that just works that day. Other side effects, sometimes I see some irritability, especially like late afternoon, because the medication's wearing off and people get this kind of weird irritable feeling. And generally what you do is you just basically increase the dose so they don't go through that withdrawal. It just you want it to kind of wean off in mid-evening, before somebody goes to bed, ideally like 12 hours. Sometimes for college students, you got to push a little higher because they got to study and their days are, can be quite long. I've had 2 people hallucinate with stimulants. That's really rare. You have to ask if they have heart rhythm problems. If they have a heart rhythm problem, sometimes can make that worse. You have to ask if there's a family history of heart rhythm problems. For most people, they tolerate them real well. Usually the biggest complaint that I get is dry mouth. That can be a little disconcerting, but it's, it can be kind of easy to treat, and mostly it's just a little bit annoying. The stimulants come in two different forms. There's amphetamine and there's methylphenidate. Amphetamine, a common medication that's an amphetamine would be Adderall. A common methylphenidate medication would be Ritalin. What they both do is they both increase dopamine. Now, dopamine is the neurotransmitter. It is the molecule that helps us regulate pleasure, motivation, attention, and motor activity. And if you look at these things, these are definitely ADHD type of modalities. What methylphenidate does, it impacts the dopamine transporter system. Now, the transporter system is, all right, you've got one nerve here, you got another nerve here, and these nerves communicate through sending chemicals back and forth. One of the chemicals is dopamine. So you've got this nerve sending out a little piece of dopamine, this nerve receives it, and then the dopamine's still in the synapse, that's the area between the two nerves. And what the dopamine transporter system does, it takes the dopamine and brings it back into the nerve cell that released the dopamine. So if you interrupt the neurotransporter system, then that dopamine will be in the synapse longer. And that's what methylphenidate does. It also increases norepinephrine through the same mechanism, except the norepinephrine transporter system. What Adderall or amphetamine does, it also will disrupt the transporter system, but Adderall will also, in addition to that, it increases the release of dopamine from this nerve cell, and also it decreases the degradation of dopamine within the synapse. Degradation means there's certain enzymes that break down the chemicals between the nerve cells so that it's not, the nerve cells don't have all these chemicals just bouncing around back and forth. But what it does, it decreases the rate of degradation from the enzyme to increase dopamine. So it does it basically 3 different ways, where methylphenidate does 1 different way. So that's stimulants, that's treatment. Hope you found this to be helpful, and I'll talk to you later.